This conference will now be recorded.
Lord. Yeah. How you doing, sir? But with that, I'm breathing. Dr. Ruthie, I'm doing on. That's Robin. She's on. If you want to speak in this public hearing, you need to sign up. If you haven't signed up already. Or you won't be able to speak unless you sign up. We're getting ready to start. Welcome to the Blaine County Board of Commissioner meeting to receive public comments regarding potential use of American Rescue Plan Act Fund. I'll ask Pastor Cameron if he'll lead us in prayer. Please stand. Martin, lead us in pledge allegiance.
Pray, Father, thank you for the privilege of serving you and serving the citizens of this great county. Pray for wisdom, discernment, guidance as we've been charged and challenged to be good stewards with an allotment of funds. I pray that it, Lord, would be very clear to us over these next weeks and months. Lord, the areas of greatest need, pray that you would stretch these funds like you did the loaves and fishes. In Jesus' name.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So, Dr. O'Phil, I'm going to zoom in, and the rest of us is present. I put a pad there at your desk in case you want to take notes. We're only going to hear comments. We're not going to discuss it. So at this time, Marie, you'll start.
Mr. Thomas Davidson.
Good afternoon. I'm here today primarily to discuss the American Rescue Plan and the benefits that it can and will produce once it's implemented the way that it is planned to be done. My theory is that the most valuable resource that a nation, a state, a county, city, or municipality can have is its people. Because the people is, where everything begins, they get everything done, and so that is the most valuable resource that we can have. And with this being said, I'm seeing that the American Rescue Plan money is basically going to the middle and lower income individuals. Because since the country has been formed, most of the rebates, most of the general monies that has come from the government has gone to upper income individuals. But since the money is designated, primarily where it's being used for the lower and middle income people, then we like to make sure that that money will get out. And we like to see, and I like to work with, everybody to get the information out to all of the people in the county so that they will be able to utilize this money with their input. They talk to their community leaders and come up with a plan on how they can utilize the monies. Then that would be a big step, a giant step in bringing Bladen County to a more progressive area than where it is right now. And one of the aspects of the American Rescue Plan is for small businesses. And so with that being in mind, that being into consideration, I talked to a number of small business owners and informed them about the American Rescue Plan and monies being available for starting businesses or business that had been affected by the COVID-19 pandemic. And they were a little skeptical because they said, well, okay, we've applied and many times we've been turned down for a number of different programs. And I, emphasized to them that, this is unlike any other program that's ever been implemented. And they said, and they were saying, well, okay, if we apply for the for the monies and we get turned down, then what is our next recourse? How can we appeal the ruling body that may have turned us down for that money? So I'd like to, for the commission to maybe address that and, and just give their comments wherever necessary on basically the things that I've said.
We're not going to talk about that tonight. We got your notes, and we'll get back with you.
Okay, yeah. I did not know that you were not going to be addressing us, so I just stand corrected on that. But thank you for, letting me have a chance to speak.
We'll find out.
Aaron Cox.
Good evening. I have a handout, if I may, for each commissioner as well as for Mr. Moore. Personally, I am here on behalf of a citizen, taxpaying citizen of Bladen County, as well as a member of the Spalding Monroe Alumni Association, or the Spalding Monroe Cultural Center. The Cultural Center has been in place since in the 80s. The Cultural Center is located on Martin Luther King Jr. Drive in Bladenboro. The Cultural Center primarily has been in operation by small donations from citizens. They've never received large grants from this body or from the municipalities. So I want to talk to you a little bit about the Culture Center.
You have another copy to give Ms. Martin. I do.
So the organization has maintained a viable relevance in the community, primarily through citizen small individual donations. The organization is located at 508 Martin Luther King Drive, Bladenboro. A lot of the things that are listed on the ARP guidelines for usage is the exact same things that the Culture Center has been doing over the years. For instance, it's been used recently for COVID-19 testing and vaccinations, community social gatherings, community classes for veterans, a thrift shop or Narcotics Anonymous program, community activities through the local churches. And these are just a few of the activities that are either current or very recent. To promote and encourage health and resilience within our communities, and especially for our children, we want to do the following. The Spalding Monroe Cultural Center wishes to build an outdoor fitness center and walking trail, a community garden project, either in the form of a greenhouse or an outdoor garden, or both. And these plans include upgrading the facility and the indoor space as well as the outdoor. And that means upgrading the basketball courts and possibly building tennis courts. In the future, long-term goals is to build a community gym. So as you can see, all of the activities and many others that are performed by the Spalding Monroe Alumni Culture Center directly targets addressing disparities in public health outcomes, addressing educational disparities and concerns, and promoting healthy living for both children and adults. The activities provide an avenue for addressing the social and emotional well-being of our community members. With financial support, the organization can do so much more than what it's been accustomed to, providing direct services to the community where people will feel it immediately. The last thing I want to say, because I can't say everything that the Spalding Monroe Culture Center is doing, I don't have enough time. But I did give you the handout, and you can see a lot of what we're doing and what the plans are, what we want to do. But I want to mention something that I heard throughout the membership and other people I've spoken with in the community from the last meeting, the last time we met. There was a concern raised here with a comment where someone said, it said that the commissioners didn't have money to just pass out to people. And I'm paraphrasing that. And meaning you, the commissioners, don't have a pot of money to pass out to people. Now, I don't know about everybody, but I do know for myself and for our group, for many of us, we don't expect you to have that. We know that there's rules and there's things that are in place that needs to be followed. But what we want to do is be represented, and we want to be here because we are citizens and we think that we should be part of this process. The Spalding Monroe Culture Center is a 501c3 organization in good standing. It is positioned to be a great partner with the county to provide assistance to the community directly in line with what's outlined in the guidelines. So what we ask is that instead of looking for every instance or some instance to exclude us, we ask that you look for every instance and possibility, legally, through the rules, whatever, to include us. Okay. I want to thank you for listening. If you have any questions, I provided on the top of that handout my name, my email address, and my telephone number. I'm available. I'm retired now, so I got plenty of time. So just contact me, and if I don't know the answer, I will do my darndest to try to find the answer and try to help clarify your mind in any way. Thank you.
Thank you, Mr. Crosby. Ray?
Anthony Thomas.
Good afternoon. As I said, my name is Anthony Thomas. I won't be before you long, and I don't have any information to pass out to you, but I hope that I can convey the sentiment of what projects we're working on effectively and thoroughly. As we think about the American Rescue Plan, we think about rescue, and these are dollars for residents of Bladen County. With that being said, we do have a lot of private organizations. One would be Thomas Training and Consulting LLC. I also partner with Moving Families and Communities Forward and for the Cause of Christ Ministries. And they're all located here in Bladen County. We've done a multitude of great things with after-school programs. We all know that we've seen our school report cards in recent years, and they've not been flattering. They've not been impressive. And last year, with students learning virtually, we did have a lot of students that fall behind. And we are requesting funding to go and to enhance our after-school, our college-bound program. So now we're talking to younger folks and getting them prepared for careers. It used to be when I was younger, we talked about things in the nature that was an unspoken belief. The longer you go to college, the more money you'll make. But as an adult, I know that that is not true. With a master's degree and credits towards my doctorate degree, I have individuals that I know that have a certification in electronics. a welding certificate and make a lot more money than I do. We want to be sure that we talk to our young people about character development, gang awareness, drug and substance abuse. We want to have a safe haven and facility. We have the grounds, we have the location, we have the staff. We need additional financial support so we're able to expand our efforts. What happens is a lot of times folks will say, well, that's not my child, or that has not affected me. But whenever someone breaks into your house, then it does affect you. And then we're doing things on the back end. So this gives us a way to address things on the front end and to be proactive, to teach these young people and to equip them with the tools that they need in order for them to be successful, not only in the classroom, but as county commissioners, you all know that dollars are generated by folks paying taxes. We want to have people to build homes or to buy homes in Bladen County. Renters aren't paying property taxes, so that's not doing a lot for your budget. But we want folks to buy houses, and they can do that if they have the skills to get a good job and they have the income to do such. So we're excited about that, and we definitely need additional funding. What I'm prepared to do is to send a budget to each one of you all before Wednesday that details what allocation that we're asking for and how these dollars will be accounted for. The second program is a community health worker program, and that's designed, I think that's an allotment that's actually approved for the dollars. I saw a diverse way of how dollars can be spent. I thought one unique thing was allowable expenses for hazardous pay for essential workers. And I do want you all to take into consideration that essential workers go beyond individuals who are employed as nurses and doctors at the Bladen County Hospital, the Bladen County Department of Social Services, Health Department. That those are individuals who are at McDonald's as well. They were on the front line and they're working. They may not be as glamorous jobs, and in the grocery stores as well. So I did allow back pay for those individuals, but I did want to talk about community health workers. A lot of folks who are hearing a lot more about community health workers in recent weeks. We want to bring on 2 additional community health workers for Bladen County. Community health workers have the task to monitor, link, and coordinate services. The best descriptor that we can have for a community health worker is very similar to a mobile social worker. So versus someone being employed and housed at the Department of Social Services, they're on the ground working with individuals, providing a multitude of information as it pertains to healthcare disparities, monitoring and linking those individuals to primary care physicians. A lot of illnesses can be preventable if treated early. A lot of folks don't know that they have cancer because they're not going through cancer screening until they're in stage 3, stage 4, whenever it's life-threatening. We want to educate communities on those things. Homelessness. I used to think for some reason if someone was homeless, they lived under a bridge or that they lived in a tent. That doesn't define homelessness. If someone sleeps on someone else's couch, they're homeless. If they sleep in a car, they're homeless. If they're staying with a friend until they get on their feet, technically they're homeless. They don't have a permanent residence. And those are some of the things that we want our community health workers to go in and to address. Food insecurity is a major thing because we have food in our home pantry, we have food in the refrigerator. We assume that that is the same thing for everyone, but that's not the case. And food pantries, even in Bladen County, have been exhausted with the multitude of referrals that community health workers have sent. You'd be surprised at the number of individuals who don't have a sufficient supply of food in their house or access to that type of food. We want to be sure that we link those individuals with agencies or organizations that are able to assist them. And we go into the root of the problem. We're not investigators, but we do investigative work. Because if someone is homeless, if someone has a food insecurity, then they have it for a reason. Okay, so why do you not have food? We can give you food. However, once you ask probing questions, and you find that this person is unemployed. And this person is unemployed because they can't find suitable employment because they don't have a GED or a high school diploma or equivalency. They don't have the credentials. Now we're able to link them to a training organization or another employment agency that could do temporary services or through the Employment Security Commission. So we want to definitely be on the ground, talking to folks, educating them, meeting their needs, and we can do a great job. We've done some great work, and we'll talk about it a little bit later in your county commissioners meeting about vaccination efforts and things that we're very, very excited about, very excited to report. So just give until Wednesday, and we'll have a full proposal for both programs. Won't be college bound. that will address violence intervention programs, and then secondly, our community health workers services.
Thank you, sir.
You're quite welcome. My pleasure. Thank you all for listening.
Mr. Dennis Troy.
Thank you. Potential use of American Rescue Plan Act funds. And I stand to look at the commissions. The struggle is real. You got a big job in front of you. Y'all got to make a decision. We come up here and just cry about what we need, but y'all got to make decisions. I got faith enough to know that y'all will make good decisions about going forward and include every man, woman, boy, and girl in what you do. I know y'all gonna do that. That's really, so many folks voted for you to do it and do it the right way. And I quote Mr. Ford here. Give a young man some good advice, Mr. Ford would say, just do right, just do what's right. And I just ask the commissioners, stand before you today, tell y'all just do what's right with this fund, where it would affect every man, woman, boy, and girl in Bladen County. And when I say that, I think about the students. What can you do to make a student successful? What can you do to make a community successful? What can you do to make a man, woman, boy, or girl successful in Bladen County? I know the struggle is real. I know we got that broadband major problem out there with COVID-19. Y'all know major problems with that. Broadband, no internet system in the lower line areas. So what can we do to make them successful out there? Because right now we're not. The other thing, what can we do to make a person with disabilities successful? What can we do? They're in school, they're working, they're on jobs, but what can we do with this money to make them successful? I thank y'all for what y'all gonna do to make Bladen County successful.
Thank you, sir.
Keith Graham.
Hello, everyone. Got some handouts. I'm going to give up to Mark and the rest of the commissioner.
All right, sir.
First sheet is better. I've got the flips in here. Thank you. This one and greetings to all our elected officials here today. I'm Pastor Keith Graham, and I'm here with our executive director, Mr. Randolph Keaton, and actually one of our board members, Ms. Althea Gibson, who's one of the officers of this courtroom. I'm the Workforce Development Manager for Men and Women United for Youth and Families. Can you guys hear me clearly? Yes. I've got that military voice. I'm trying to project a little bit. And we're here for Men and Women United for Youth and Families, who is a 503c organization. I've been serving Bladen County since 2008. And we're a nonprofit organization built to help empower, encourage, and promote our citizens of the county towards economic and professional growth. We have some strong partners who have partnered with us over the years, which include Golden Leaf Foundation, KB Reynolds, Travel Trust Organization, Anonymous Trust, D. Smith Reynolds, the Conservation Fund, and various others. We have some of our local partners here, which is Blaine Community College. We're partners with the Rotary Club, as well as the New Hanover County, Bladen County Schools System. We've served a lot of people here in our county. And some of the missions that we have for our organization, we have our agriculture entrepreneurship program, in which we take our youth and we help them prevent recidivism, help prevent them from getting in situations and circumstances that would lead them into jail, lead them into promoting them into that track. So we have our agriculture entrepreneurship program, which some of you may have heard of, Youth Ambassadors for Better Communities, in which we serve our youth. We bring them in, we teach them leadership skills, developmental skills. We put them on a track that they go and talk before political bodies such as yourself in Congress and so on and so forth. And our organization has created a model in which has been replicated throughout the state of our Youth Ambassadors program. It's an entrepreneurship opportunity for them because we do farm to table food to help deal with, in our county, as well as our surrounding counties, with healthy food is such a problem. So we teach our young people about healthy eating, about growing their own food, about developing, because as you all know, many of you are from here, that was our chief source of income for years, was the development of farming. It's starting to become a lost cause. So we're pushing it back into the mind of our youth so that they can go forth, on to college, come back and be able to repeat those great traits that were learned through the soil that we grew up here. So with that program, they actually go, they aggregate all the food, they pull all the food. We work with local farmers throughout our communities here in Bladen and surrounding counties to help them be able to sell their produce, make a living for themselves. They bring the food in, we aggregate it, and then we go out, the youth go out sell it. You may have seen, for those, how many of you guys go visit the farmer's market on the weekends? You've seen a bunch of youth out there selling vegetables and fruit. Those are the youth from Youth Ambassadors program. They're out there, you see them, they're serious about it. They're for real about it because they've gone through some extensive training, they've gone through some peer mediation, they've gone through the developmental skills. I don't know about you, but I'll take any of those kids and put them beside me anywhere because of the development, because of the training they've learned right here on the Bladen County soil. So with that program, it's an opportunity to help develop them to the next level. And then also we have a food pantry in which we give out food twice a month. And we've served, we just won the governor's award for giving out over 700,000 pounds of produce over the past year. So that goes to show that organizations and agencies can trust the body of work, and there's evidence produced at the end in terms of outcome of what's being done. So the food pantry is very successful. And also, we have our workforce development project, in which we have been entrusted from Golden Leaf. We started with a 2-year project in which Golden Leaf entrusted us to bring the community together. And we started a community co-op called Communities Connected for Success, in which we come together, we determine what are the needs of the community. And one of the things with this workforce development, that there is a missing link between, especially the pandemic came and hit afterwards, so it exacerbated it even more. But being able to come in, and we use a case management model. And our case management model that we use is client-centered case management, in which we go in and we work with the clients and their families, and we do a full intake and assessment, and we determine what are all the needs of the family, whether there's mental health, whether there's physical health, whether there's substance abuse, whether there's judicial issues. And in the case management model, we sit down and do an ISP, and we work out a plan for the whole family to become whole, healthy, and productive citizens of our county. So with that plan, we lay out a full plan with them, and then we're able to identify whether you might not be working because you didn't finish your GED. You might not be working because you don't have the skill sets. You might not be working because you had a past history. But we help work with them and work with our partner organizations to help remove those challenges and those barriers that might hinder them from being in a position to get a job. But we don't only want them to get a job, so we help deal with their life skills. We help deal with professional development so that they not only can get a job, but they can keep a job. It's not just enough to get a job or keep a job, but to get a living wage job. So what does that mean? That means that we've got a credential, We've got to certify. We've got to get people in a place they can get jobs that will help feed their families, help give money back in terms of taxes and be productive citizens to our community. So we help develop them, and in a case management model, we work with them all along the way. We're knocking on their doors. We're sitting at their tables. We're talking to their parents. We're talking to their grandparents, because we grew up in this community and we know what's on the ground, what's in the houses. They invite us in to be able to help their children in their household. So with that workforce development program, we've seen success. We served in the past year and helped over 60 people so far in terms of evidence-based, being able to pull that together, being able to see the results of getting people in the flow. And we're partnered with Cape Fear Community College, not Cape Fear, we're partnered with Blaine Community College and other organizations to help with that process. Matter of fact, just in the past month, we've gotten 6 people enrolled in classes over at Bladen Community College just this past month, since the first of the month. And that comes from people that ordinarily wouldn't have thought they had an opportunity. But we sit down and we lay out a plan with them. We walk them through their plan. We communicate them and help promote them to fulfill their plan so they can get to the end result of being productive citizens, being able to move forward. So in terms of the American Rescue Plan, looking at the qualified census tract, which was some of the information that came through about some qualifying factors, and addressing like the public health disparities. In our case management model, what we do, we pull in, we partner with our farmers to help produce for distribution of food, expand equitable access to good quality food. Not just eating beans and weenies and things like that, but eating food that's going to help them live longer. It's going to help them think better when they get to school, help them become better productive, and have an equal opportunity to compete with other counties and other parts of the state that have flowing resources to them. Also we are looking to address educational disparities. We've done summer camps for well over the past 8-10 years. Very easily. And a lot of the summer camp work that we do, we've done it in kind, out of the love and our passion for our youth and our children. We partnered with the Bladen County school system, which we've used some of the school systems to do the summer camps, some of the programs. And with that process, we sit down and we teach them leadership, we teach them mentorship, we link them with resources to give them visions of being able to excel beyond what they've seen and what they've experienced in the local level and in their local communities. And we've seen some great people come out of our program, go on, and we do scholarships this year as well. So in those scholarships, we normally give out about $9,000 on average per year in scholarships. One year we were fortunate enough through contributions and generous offerings to do $16,000. But we've got children that have gone off to college, become pharmacy techs, become medical professionals, become, help me out, Mr. Keaton.
We have some veterinarians.
Veterinarians.
Become veterinarians. But I would also dare say, and I like to say to Althea back there, Althea Weaver, not this kid. She's my board member, so she might get it. But one of the things I would like to share with the board, that several of our board members are from Bladen County. We are located in Delco, and we work closely with our partners in Bladen County. A lot of the work that we do, our work is more around a regional perspective to economic development. And as Brother Keith has been sharing with us, a lot of our work has lined us up with partners. What we'd like to do is continue to leverage the work that we're doing. This pandemic has created, it's been devastating to our community. And so what we'd like to propose to partner with the county on, looking at how we can go from not just distributing produce and distributing free produce, but we also want to teach life skills where we can teach young people. We've got a program now where we're partnering with NC State and others. So we're taking our local farmers' produce, farmers from Bladen County, the Bladen County Cooperative Extension Office, Brunswick County Cooperative Extension, and Columbus County Farmers Cooperative Extension work with us to build this program. It's
been in existence now. This is our 4th year, and we're trying to figure out more ways to make money. So we're selling produce from our local farmers to the beach community. We want to do CSAs. So what we're looking to do is try to figure out a way with our young people who are so bright. We want them to come back to Bladen County to live. And so that's part of what we hope to do with some of this funding. We all understand the trauma and the stress that's happening now with our folks. And I've said, we've been proud of the work that we're doing, trying to help our individual families from a case management perspective, speaking on how we can help our communities be better. Bladen County, great county. I went to school in Bladen County, had the best teachers ever. And I dare say, but right now where we are with the pandemic, we've lost a couple Head Start programs. We've lost a satellite community college there in East Arcadia, and that stuff is not coming back. We can't continue to lose our folks through lack of education.
And another category, promoting childhood as a healthy childhood environment. Just as Mr. Keaton was talking to that, all of the programs we use, it helps promote that healthy childhood environment. And with our case management model, that's what we do to help promote and move those things forward. So we ask you to consider Men and Women United Youth and Families. And as he said, that we help our children, we help the whole family, our children, our youth, and adults become better Blaine County citizens. So thank you for your time.
Thank you, sir.
And we really appreciate it.
Thank you, Right. That's it. Is there anyone here who wants to speak that hasn't spoken? If not, I'll close this public hearing and I'll ask the motion to adjourn. Action camera safe by Danny Ellis.
Mr. Peterson.
Yes.
Mr. Gillespie.
Yes.
Mr. Britt.
Yes.
Mr. Cox. Mr. Ellis.
Yeah.
Mr. McGill.
Yes.
Dr. Mungoen.
Yes.
Mr. Bullock.
Yes.
Mr. Hester.
Yes.
All right, we'll adjourn to 6:30.
This conference will now be recorded.
That's right.
Was it in the 11th hour?
Okay, I'm going to repeat. Chairman of the Board of Directors. I'm actually. It starts in 7 minutes. Pretty good presentation. I knew about that, but I never seen all the details. Relationship. You really was enlightened, no one.
I always suggested, so we do.
Oh, everything is very important.
Welcome to the Blaine County Board of Commissioners meeting for September the 20th. Reverend Rudy Ramfall will do the invocation, and Greg Martin will lead us in the Pledge of Allegiance. If you please stand.
In the interest of full transparency, right after the Pledge of Allegiance or shortly thereafter, I'm going to slip out. I don't want you to think that I know something you don't, because that is very rarely the case. But we know that governing is difficult, so we feel like it's right and it's good to begin this time with a word of prayer. Let's pray. Father God, we look to you, to whom all hearts are known, every motive open. Lord, we lay this proceeding before you. We thank you for your presence here. Thank you for every person in this room that is a county commissioner that has answered the call to lead. Thank you, Lord God, for every person, every citizen that has shown up to be a part of this process. Lead them, guide them. And may everything that we do bring glory and honor to you. Hear our prayer. We ask all these things in the strong name of Christ. Amen. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Rudy, if you would, please. I want to present you with a Blaine County pin that says, "In God We Trust," above it. And I also want to give you a token of a Blaine County coin that says, "Thank you."
Thank you. Thank you.
Thank you, sir.
So I appreciate this. I appreciate the work that you do.
Thank you, sir.
Thank
Have a
you.
good one.
So before we approve the consent items, I want to, if it's all right with the board, remove, 5A. Dr. Tate's not gonna be here, and I understand Mr. Caudill is gonna speak on the interest of commissioners. So someone, I can take a motion to approve with 5A removed. Any discussion? Ms. Marie?
Mr. Peterson?
Yes.
Mr. Gillespie?
Yes.
Mr. Britt?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Mungoen?
Yes.
Mr. Bullock?
Yes.
Mr. Hester?
Yeah. And also, Dr. F. Mungoen is on Zoom tonight, and the rest of the commissioners are present. Commissioners, if you'll please come forward. I'd also like to ask the Russell Freestand to come forward. And we invited, commissioners that serve with Russell, so we got Mr. Bill Ray Pate, if you please come forward, and Mr. Wayne Edge, if you please come forward. Make your way in here, pass away too. I didn't. I'm correct. It's hard to believe that it's been almost 14 months since Russell Priest unexpectedly passed away on July the 30th, 2020. At the time, he was in his 10th year and third term as a county commissioner. Russell loved Blaine County, and over the years, he was actively involved and had a positive influence on so many ways in this community. As a teacher and a head coach, as an elder, as a choir member in this town Presbyterian Church, as a member of the Optimist and Kiwanis Club, and as an elected official on the town of Elizabethtown Council and the Blaine County Commission. The members of the Board of Commissioners believe that it is important that we maintain a physical symbol to honor and remember Russell's legacy to serve Blaine County. Therefore, we are pleased to place this plaque on the wall of the Commissioners' meeting room as a lasting tribute to Russell's memory. And furthermore, we're glad that Dahl and the Priest family are here for this special occasion as we remember Russell. And we're also glad that Wayne and Bill Ray Pate came. So, Dahl.
All right.
My children doing like, Maria and Greg and Alan and all the commissioners that are serving now and the ones that will serve. And also, being one guy, I want to thank y'all so very much. This means a lot to all of our family, and we appreciate you keeping this legacy alive. You loved it, you really did.
We love him too.
I miss his smile.
Oh, we got a little reception in the first room to the right. I'm sorry. Thank you. Okay, and, I mean, a little bit of that, so please go and buy it on the way out. Everybody's welcome.
This conference will now be recorded.
I want a picture of this, we'll just clap to the family. So,
Wow. You know who got it? That was and they really saved the president on Keyshawn has it. Yeah, I was going over. Is anybody else on our phone has a picture of?
Not my camera, but my phone. Yeah.
How you doing? I'm sure. Is all the family here? Okay.
No, the short one's in the front.
What I would suggest is, if you want to, put your hand while you're doing the picture, because like, if you're okay with it, right here, if everybody's okay with
My hand over here.
Y'all ready? Okay. 1, 2, 3. Okay, I got one.
I got there. Okay, we got it.
Let's do this.
Take your phone off.
You two get there. Okay, come to the side of him. Come over to the side. You guys come up here. You got yesterday? I saw you.
I'm sorry.
Okay.
Yeah. AKA bus driver.
Y'all clean up what? And we can edit it and then, short ones in the front.
Here's his wife. Good to see you. Hey, buddy. You see you.
Thank you. Thank you. Thank you.
All right.
Yeah, I know, I bet y'all put up.
The preacher better here.
The ball field.
He has about 15 bears.
Yeah, that's right.
He's gonna be home in church.
But he had to get that roar.
Hey, let's start. What's going on? How are you, man? How far did you run today? That's good. Yeah. I tell you who he is. You know, he was roommates with, what's his name, John from Blaine Priest. Tom. Yeah, good friend. Yeah. I was over there. Wasn't he 3 years? He was 3 years ago. But then I know John. Yeah. They know roommates. Could be wrong.
I feel like Charles Ray put me in the corner. You know, we were all back.
The rules of pressure. What I think.
We don't have everything if we determine something's not beneficial for the community.
Like pretty cool.
So what other one of the three?
I want to get a lot less. That's the new mask that they make with the whole cigarette.
Okay, guys, we ready? Ready? Spring? Matters of interest to the commissioners. Who's got something? Is that the way what we've done for this? If you want to talk, that's matters of interest to commissioners.
Sure.
I'm for. Oh, I'm sorry. We're at, Bladen Smart Start. Okay, I'm sorry, thank you, Roy.
Good evening. Good evening, Bladen County Commissioners. First, I would like to thank you for your time and allowing us to address you tonight. My name is Takara Osborne. I'm the Partnership Engagement Coordinator for our local Bladen County Smart Start. My position is funded through a grant through the KP Reynolds Charitable Trust through Prevent Child Abuse North Carolina to build a community prevention plan for the Tri-County region of Bladen, Columbus, and Robinson counties. Alongside me tonight is Dr. Kathy Gantz and Randy Ellis. We have worked together over the last year, along with other community agencies and individuals in the Resilient Bladen Coalition, to build the plan that we have in front of you tonight. In the fall of 2020, we started the work here in our Tri-County region to build a community prevention action plan with Prevent Child Abuse North Carolina that would address and raise the awareness of adverse childhood experiences and trauma in the children and families of southeastern North Carolina. It would also lay out strategies for building resilience in families and building the capacity of community leaders, agencies, businesses to practice resilience and become protective factors. We started off by bringing together community leaders and agencies to be part of the CPAP committee to the table to do an environmental scan for each county. This environmental scan showed our gaps in our 5 protective factors. Those are also outlined in the plan. We saw that our gaps were many across the board. 2 that stood out were knowledge of child and parenting and child development and social connections. Taking this into account, we began to write our Tri-County plan and the Bladen County plan. We worked together to gather data, plan strategies, and research programs that could be brought into Bladen to help these families. We even named our committee Resilient Bladen that was born from this work. We know that this work will take many years to reach the community and to change the outcomes of all citizens in Bladen County. We learned a few things from the various data that we had seen working when we did this work last year. Randy and Kathy would like to share some of that data with you.
I'm Randy Ellis. I'm the Garden Ad District Supervisor for District 13, which covers Bladen, Columbus, and Brunswick County. I'm also the chairman of the Bladen County Juvenile Crime Prevention Council. We've seen in Bladen County from the numbers in our Garden Ad program, a 30% increase this year in children in foster care. And over the past 24 months, a 50% increase in foster care in Bladen County. That's pretty across all 3 counties, including Columbus County as well. And what these children And what it looks like for these children is, these are facts that we know from the Department of Justice. 1 in 3 children that are abused, if untreated, go on to be abusers. They're 11 more times likely to end up engaging in criminal activity. And 25% of inmates in prison right now have reported either neglect or abuse as a child, coming back to adverse childhood experiences, trauma in childhood. 2 in 3 people in drug rehab report abuse and or neglect as a child. And we also know that longer children stay in foster care. I know I'm a 4-time adopted parent. They fall farther behind in school. According to the Department of Justice, 2017, the United States spent $124 billion on foster care. It's 2017. Imagine that now. Numbers for North Carolina. In 2010, North Carolina had 10,957 children in foster care. 2017, that number increased to 18,083. As of 2020, the preliminary data is over 20,000 children in foster care in North Carolina. Guys, that's 100 counties, 200 kids average per county. So we do know there's cycles in this: domestic violence, physical and sexual abuse, and substance abuse, including prescription drug abuse, as well as methamphetamine. Dr. Gantz can take over from there.
So let's take a look at the local students of Bladen County. And each year, our Bladen County students take a risk behavior assessment survey, 9, 10, 11, and 12. And so some important data I'm going to share with you from 2019. So according to their responses on alcohol and other drug use in 2019, 17%, which represent 112 students, have ridden in a car with someone who was drinking alcohol 1 or more times. 19%, which represents 129 students, have been offered, sold, or given an illegal drug on school property. 33%, 217 students, reported gang activity at school. 20%, 131 students, have seriously considered suicide, and 17% of those had a plan to attempt suicide. 13%, which represents 73 students, have attempted suicide 1 to 5 times. And 2%, 9 students of those reported attempting suicide 6 or more times. And 4%, which represents 22 students, said their suicide resulted in injury, poisoning, or overdose that had to be treated by a doctor or a nurse. In 2020, Bladen County EMS responded to 90 overdose calls and administered 102 doses of naloxone. In August 2021, Bladen County Health and Human Services embarked on a journey of providing naloxone nasal spray to persons and families suffering from opioid addiction. To date, in August, 2 were dispensed, and this month, till the date, 1 has been dispensed. The number of overdose deaths in 2020 were 15. Please note that some are still pending. And in 2021, from January to September 17th, of the 210 deaths in Bladen, 11 were overdose deaths and 11 are pending.
So we learned a few things from the various data that we have seen since starting this work. And so we know now that there's an underlying crisis in Bladen County. And it shows through the data that we presented to you, and the ongoing long-term indicators of adversity and ACEs are rising in the county. Our Bladen County Smart Start has applied for a $250,000 grant from KBR for the next 2 years for resilient Bladen work. As outlined in our plan, we will train staff as trainers in various resilience-based training programs that will reach the community at large, and will focus on our rural and low-income areas of the county. ACEs affect everyone, even if it doesn't happen in your home. As part of this grant, we will also bring a parenting program called Strengthening Families to Bladen, where we will hold 14-week parenting program classes for children birth to 5 years old through our Smart Start. It's a family-based curriculum, and it also includes classes for the children. We as Resilient Bladen Coalition come in front of you tonight to ask you to sign a resolution of support for the Bladen County plan. By signing this, you acknowledge that there are many factors present in Bladen that are leading to child abuse and neglect. We acknowledge ACEs and adverse childhood experiences are affecting the children and adults of Bladen County. By signing the resolution of support, you are reinforcing the collaboration between agencies and community leaders to make this a success for everyone while we educate the public, raise awareness about ACEs, and build a trauma-informed healing community. Thank you all for your time.
Mr. Brett made a motion and Mr. McGill seconded it. Any discussion? So, they're not positive numbers for Blaine County, but they're real data, and we really need to publicize this data. I mean, people sit around here wanting money for things. We got numbers here to support what needs to be done in Blaine County. And I know you came to the opioid task force, and we're trying to get going again, and COVID kind of shut us down, so we would really love to partner more with you.
Yes, sir. I appreciate that.
Mr. Peterson?
Yes.
Mr. Gillespie?
Yes.
Mr. Britt?
Yes.
Mr. Cogdale?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Mogoen?
Yes.
Mr. Bullock?
Yes.
Mr. Hester?
Yes.
Thank you very much.
Thank you for what you're doing. Thank you. We omitted item 5, and where it matters of interest to commissioner. Any commissioner have anything to say? From my comment, Stockdale?
Okay, let me kind of bring the board up to speed on some things that happened over the weekend. The clinic was put on, the vaccine clinic, on Saturday, and there was a total of 121 people that received vaccine, the first vaccine. There was 108 people that got COVID tested. This was orchestrated through an outreach to Ms. Holly Wilson, who's a community specialist for North Carolina Department of Health and Human Services with Manny Cohen. And they referred me over to the gentleman that I thought was going to be here today, Dr. Tate, who runs and heads up Mount Calvary Center for Leadership and Development. And his field representative is here tonight, I think, of Mr. Anthony Thomas, staff. And also Ms. Letitia Hill Gadet of Alphabox Laboratories was the one who provided the vaccine for the Vaccination Clinic. And she is staff certified, state certified for vaccine vaccination and operating clinics. She's been doing it statewide. And she is saying that she would be glad to come back to Bladen County and conduct the clinic for the second dose, and anyone else who will want to come in and join in on that activity. And she invites and extend the invitation to anyone that would want to be in support of them helping her and Dr. Tate to make this possible and provide support. And we had approximately 250 people on site, and it kind of caught everybody off guard because the event we didn't expect, and they didn't expect for it to be so successful because we're very successful. But we lost quite a few individuals because it was hot, the time of the event, and the amount of time it took to get vaccines and people armed because of the limited resources that were there at the time. But they said if they returned, they would bring adequate resources and would like for Bladen County to be supported and join in the next event, and they would be glad to do them at any given time that we would want it done, that they would support that issue with our health department or whoever's available to do it throughout the community. And I looked at it go on Saturday. We passed out masks, we passed out hand sanitizer, we passed out wipes and did that type of distribution, and water, food. We did everything we could to try and get some of the people to stay. But it was so hot and the weather was so bad, we lost probably 75 people who did not get vaccinated. Some of them was handicapped, some of them was in wheelchairs. This gentleman had to come on the outside and do curbside. So it was just kind of difficult. And I'm hoping that when this come back again, that we will look at this as a county issue and be supported in any way that's possible. And maybe, I think with some communication breakdowns, that we can establish a better line of communication when we get ready to do this the next time. And that's basically what happened. They're looking forward to coming back to work in the county again.
Any comment?
Mr. Chairman, I'd like to say one thing, the Commissioner talked down and say, the first supplier was supposed to have been there at 8 o'clock. What happened, that supplier had problems with that automobile, and so that threw everything behind. The next supplier, the backup supplier, came in at 10:30. But the program should have been from 8 to 1. So we ended up from 10:30 to 5 o'clock with the number of people that were there. It was very successful, and we appreciate everyone who supported it. We had a lot of people to support that. As he said, a lot of people left because of the time frame, because it was from 10:30 to 5 o'clock, 5:30, something like that. Thank you, sir.
Anyone else?
It's Dr.
My
Montgomery.
comment.
Oh, go ahead.
Dr. Owens? Yes,
Yeah,
ma'am.
I just, go ahead.
Go ahead.
Oh, okay. I just want to know that I think that would be an opportunity for our health department. I know we go around to different locations in the county to dispense the vaccine. I think that's a great opportunity if when they hold this next outreach session, that would be a good opportunity to partner with them and even use their vaccine, or if not, that's something maybe Dr. Duncan can bring her staff, and parallelly, they can offer the vaccine. I just don't, if we can vaccinate as many persons that show up, I think that will help reduce the spreading of this disease, or at the same time, possibly save a life. So I think that's something we should at least consider. Dr. Duncan, if you're there, I don't know, but I think that's something I think would be worthwhile.
So, as chairman of the Blaine County Board of Commissioners, this Board of Commissioners voted not to pay people to get vaccinated. Unless this board changed their mind, there will be no help to subsidize these vaccinations, because this board voted not to do it. We're not going to pay people to get the shot. So we're not going to do it unless this board revotes.
Let me comment on your comment that you just made.
Crazy.
Listen to you making this comment. When I seen the people out there that were getting vaccinated, they was from all demographics. Everybody was there. White, black, Hispanic, Mexicans, everybody you could see was out there. And this issue about $100. If we put the price tag on people's life in this county for $100, it's a false statement for us to be making a statement that we don't value life at no more than $100. That's, to me, seems to be the wrong message this board needs to be sending.
The message she's sending is,
the thing what she said on this, Ms. could have paid her staff, they would have paid her staff to work, or whatever it involved. Our job is to protect the citizens of this county, not to worry about playing political games with people's lives. I hear her tell us every time someone has COVID virus, it's a possibility of them infecting 10 people. We lost 75 to 100 people. That's 1,000 people that has the probability of getting that virus. My concern is not about you and how you feel about the board, but getting people in this county vaccinated. That's my only concern.
let me rebuttal and I'll give you.
Only concern I got.
The wrong message to send is that if your life ain't worth more than $100, takes $100 to get you to get the shot, your life ain't worth nothing anyway.
That's the way you feel about
Dr.
it.
Ellis.
I have a question. I know the gentleman, when he appeared before the board and made the declaration, yes, sir, that you guys are going to be doing an event. I do not remember, and of course, correct me if I'm wrong, I don't remember the county being invited, Dr. Duncan being invited to be a presence at that particular event. I don't remember anything about that, or that it was orchestrated that, okay, we're starting at X hour. We want the county to be there. We'd like Dr. Duncan to be there. My understanding from listening about some of these issues anytime you're called in the 11th hour and you're asked to, hey, I need you to show up. By the way, we've got more people. When you're caught by the seat of your pants, that is a little bit of an issue. So just correct me if I'm wrong with the health department. They were notified the entire time leading up to it? Sure, yeah. I'd like to hear what the facts are.
No, we're not gonna do it. If you wanna talk, you sign up and you can talk at the end of the
all right.
We're not gonna answer questions.
Okay,
He's out of line by asking you a question. If you wanna sign up and speak later, you can speak.
Well, I understand. I'm not asking questions then. I'm just making a statement. My understanding was that the county we've not been notified of a presence for Dr. Duncan to be there that Saturday. I understood it to be that you guys are going to show up and do it. We kind of listened to your declaration that night and kind of moved on from there.
That was the presentation they made.
But let me say something to people before we move on to the next thing. I took it this way, and this is where I'm kind of at odds with what's going on. When Mr. Bullock called me Saturday morning, I was at home. And when he came up, he said, Miss Duncan is here at the site at 4:08. I said, what in the world going on? He said, she's at the site. I didn't know it was a breakdown in the communication part of how this was going to be handled. I didn't know what had been negotiated. I came down to see what was going on. When I got there, Arthur referred to me with a statement that Ms. Duncan said she could not be involved and that she had to leave and could not participate in this event. I did not know that communication breakdown existed, Mr. Peterson. I thought that she was there on site to accommodate what was going on. And that was the only thing I asked just now. If we as a county can try and communicate to put vaccine in people's arms with the COVID virus raging the way it is, school closing, people, every time I get my phone call, someone's calling me about the COVID. And it seems that we have no interest at all as a county commissioner. Mr. Brett.
I was here obviously when they presented their position and what their request was and what they were planning to do. And I understood that. Y'all presented it, we heard it. But when someone calls any supervision in the county, this is a board. No one, I would assume, would have the authority to take action that could possibly put the county in a liable suit without the okay from the county commissioners to do and to perform and be involved in ejections or things of that nature without us approving it for Dr. Duncan or for Mr. Dallas or anybody else in supervision. This is something that would have to come before. She would have to ask. We would have to give permission. I think there is the big issue at this particular time on that Saturday. And I would not have done it myself because I would be acting without the okay from the commissioners when they had already took a stand. But forgetting the stand we took, I look and respect her or anybody else in supervision that would be stepping out on their own and making that decision, whether it's EMS, Dr. Duncan, or anyone else, because of putting themselves in a position without having approval from the county manager or this board. So I think we all need to understand that. You're asking somebody like Boone and you put them on the spot.
Well, I've got one statement. I was there when Dr. Duncan was there. I asked her to help us with this vaccination. She said she could not because it was being held by a contractor. But the gentleman there said he could get them to sign a release. There will be no liability if they sign that release. There will be no liability on the county. And also, one of the paramedics came by and he contacted Mr. Nathan Dallas in regards to this same thing. So the thing about it, though, we just need to come together and work as unity for the betterment of the citizens. That's all we have to do, work together. It's for our citizens. It ain't for me. I got my 2 shots, but we need to work together for the betterment of the citizens. That's what we need to do. Thank you.
All right.
I would just like to say to your group and just say at large, the health department, they are open every day. She has worked her tail off going here, there, and everywhere, getting these vaccines done. It makes me, every day, all day, they have events. People are free to go to this health department and get shots. If the public wants vaccines, they can go get vaccines all day, every day. So it's a little disturbing hearing now, all of a sudden, that Bladen County's not doing its due part. No, we're doing our due part. She's been doing it the entire time. And I don't like her being cast out as though all of a sudden she, I just want to make that statement.
Well, we're going to end this here, but I want to tell you, you talk about unity, Mr. Bullock. When this board of commissioners vote on something, that's unity right there.
Well,
We voted, we're not going to pay people to get the vaccination. So therefore, no, we're not going to support anybody being paid with the vaccination. It's the same money almost. And I told Dr. Duncan nothing. Mr. Carter, you have no authority to call them people. If you need to talk to somebody in Blaine County in charge, you need to call Mr. Greg Martin. That's who I called. You called him and asked him for David Howell. That's who I called. I called him to ask him for David Howell. You didn't tell him what. And then David Howell told me I need to reach out to Dr. Terry Duncan. Don't tell me what I did. I know what I did. Don't tell me what I did. I know what I did. You did not tell me. I know what I did. You said what you heard. I know what I did. You said you did not give me any information. I called him and asked for David Howell's number, and then he told me to call Mr. Duncan. Don't tell me what I did. I said, but you never give him any information on what you wanted Mr. Howell for. Do you call everyone you see Mr. Dowd? Do you tell him I need to talk to Greg Martin? You talk to him every time I see you want to talk to him. Well, how come I can't talk to Mr. Duncan if I want to talk to him? Who you supposed to be? I'm just telling you the way to change. Who you supposed to be? You can talk to the department head and I can't. I didn't say that. I don't tell them what to do. There's a chain to talk to. There's a chain of commands. Well, you call the chain of command, then I follow. I do. Now, I see you right here telling somebody what to do. I do. I ain't telling somebody who's going to do what. Unless this board changes their vote, we're not going to support no funded vaccination. You can do it without you having that. No, it don't have to have that. Dr. Montgomery.
I just have a comment. I'm not asking the board to support anything. We don't have to support it. At the same time, it will still happen. My only comment was, the health department will actually go to different locations and it will be the same thing. I don't care if I can stand out at the same location and those same people get a vaccination by the health department. I could issue them a card. It's the same thing. That's not even the point. My only point was that's an opportunity to vaccinate people. I don't care about the money, because we can give that anything. For the same one to go to the health department, we can tell them, because you've gone to the health department, just come to us and we'll give you the card. That doesn't matter. So I think we're going about the wrong way. We vote on it, I'm done with it, but I'm just saying, to say that because you won't give them a gift card, who cares about a $100 gift card? If somebody wants it, give it to them.
Okay, thank you. Item 7 is Finance Office. Item 6, Matt Hope. So item A is consider adopting a resolution requesting Blaine County Board of Elections to hold an election regarding alcohol beverages. What's the pleasure of the board?
I've got a question.
Okay, on that?
Yes. Okay. If we pass this, what impact would that have on the Open Door Task Force or substance abuse in Bladen County?
It won't have no effect.
No effect on it.
You got it in every town.
Okay, I just want to know if we pass this, what, and I think Dr. Gant gave a good report, and you're saying that it would have no negative impact on what she gave, the report she gave us.
All we're doing is asking for it to be put on the referendum for vote.
Yeah.
This is all we're doing. This is for anybody with business throughout
anywhere in Blaine County.
Anywhere in Blaine County.
The whole county.
Oh, good. And this will be on the election on 2022, correct?
If the board approves it.
Yeah, thank
you. Yes, ma'am. So what's the pleasure of the board, Mr. Chairman? I make
and I've had a little bit of time to talk with the folks that made the heartfelt plea, and I appreciate their heart in wanting to better Ammon. And I heard the term, the glory days, the former glory. I long for the former glory where alcohol wasn't so readily available. And maybe I'm the only one in the room, because everybody knows what I am and who I am. But I hear we make a resolution and we all agree unanimously to stand against abuse and stand against alcohol abuse. You may or may not know this. We're so bound and determined to get a needle in somebody's arm. What about preventing things getting in their mouth? And there are 95,000 alcohol-related deaths in America every year. And I know you said, well, it's just putting on a bat, letting the people make a choice. But I keep hearing we say that part of our job is to protect the citizens of Bladen County. So if we know something is bad, it's the gateway drug, why would we want that to be more readily available? Whether it's abuse, whether it's drunk driving, whatever. Again, I do think we bear a responsibility to sort of stand between, what makes it to a ballot and that sort of thing if we feel like something is not best for the community. And I wished it wasn't so much a part of the economy that businesses feel like they can't make it without that. So I appreciate the heart very much of the folks. But at the same time, I would do anything that we could. I believe if we really took seriously the health of our people, we would take seriously alcohol as much as we do COVID.
I make a motion that we accept the resolution.
Motion by Mr. Cardell, second by Mr. Gillespie. Any more discussion?
I just, Dr. Mangone, I have a question, a comment.
Wait a minute.
I'm gonna speak, in reference to, I served 15 years prior to being a commissioner on the Board of Elections. And this is not a vote whether I would vote for alcohol or against alcohol. I represent people. This is the people's choice to vote for it or not. I am put in a position to give people the opportunity for choice. And then they can vote it up or vote it down. But I want to preface that before I make my decision so you understand where I'm coming from. I do believe in the American due process, giving people the right to choose or not to choose. So I will let the people decide when they cast their ballot whether they want it or whether they don't.
Dr. Garcia?
That was part of my comment. The sentiment was to give the citizens of Blaine County to vote on this, that we're not saying yes or nay. And then at the same time, we're not supporting alcohol. We're not trying to cause any medical issues that may result of alcohol, but we are trying to support it to prevent COVID. So I don't quite get some of the connection on these things, but okay, I'm ready to move on.
Ms. Marie?
Mr. Peterson?
Yes.
Mr. Gillespie?
Yes.
Mr. Brett?
Yes.
Mr. Cogdell?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
No.
Dr. Mungoin?
Yes.
Mr. Bullock?
No.
Mr. Hester?
No. Okay. Item 7, Ms. Lisa.
Good evening to each other. I'd like to review the dashboard with you for the month ending August 2021. The general fund revenues at the end of August were 17.65% of the budget, and the expenditures were 16.21%. And the general fund and the solid waste, we collected 29.23% and spent 10.91. Emergency 911 had collected 8.34 and spent 3.38. And the water department had collected 18.64% and spent 3.54. Any questions on that? If not, I'll move on to the federal. At the end of August, we had paid out the bond payments for the jail. So at this present time, we're actually in the negative, but if we hadn't made that payment, we'd have been about $174,000 to the good. So right now, we got a little catch up to do.
Any questions?
Any questions?
Thank you, ma'am.
Thank you.
Health Department, Dr. Terry Duncan.
So I think our first item under my section is
to consider approving the professional services agreement with the County of Columbus. This is a renewal.
Motion by Mr. Cameron, second by Mr. Bullock. Any discussion? Ms. Marie?
Mr. Peterson?
Yes.
Mr. Gillespie?
Yes.
Mr. Britt?
Yes.
Mr. Cogbill?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Hester?
Yes.
Item B.
This also is a renewal. In essence, it's the 2021-22 influenza vaccination fee scale. We're proposing no increase or charges at this time.
Motion by Mr. Britt, second by Mr. Hester. Any discussion? Ms. Marie?
Mr. Peterson?
Yes.
Mr. Gillespie?
Yes.
Mr. Britt?
Yes.
Mr. Cogbill?
Yes.
Dr. Ellis?
Yes.
Mr. McGill? Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Hester?
Yes.
And item number C is approving a rate increase for hepatitis A, Tdap, and the Menactra vaccinations. Annually review the fee schedule, look at our rates compared with others in the same category, and we're proposing increases in your packet.
Second. Mr. Cameron, second by Dr. Ellis. Any discussion?
I have one question,
Yes, sir.
Dr. Duncan, and we might have already mentioned this earlier in another setting or something, but if a citizen has no cash and no insurance, and they come in for services like for these 8B and 8C, what do we do then?
We would work with every opportunity, and we have talked about this before, working with social services to try to see if there's some monies available there.
Indeed. Okay, all right, thank you.
I have a question.
Yes, ma'am.
My only question would be, did our costs increase?
Our cost did not increase, but the reimbursement from the pay plans increased.
About the same amount, or is it more of us to get a profit?
If we can't, if we don't charge the larger increase, we're not going to get the most for our money.
Well, I know, but it's a health crisis for hepatitis.
Let's say Medicaid charged for, if Medicaid would reimburse at $50 and we were only charging $40, then we're not getting reimbursed at the rate that we could.
So for hepatitis A, what is the reimbursement? I know now we're saying it's 75, but you want to increase it to 85. What is Medicaid reimbursement now?
All of these are slightly less, and you set your prices just a little bit more so that you come under and you can get reimbursed at the rate.
Understand that. But at the same time, I'm just saying, are we increasing? You're telling me that Medicare probably reimbursement is about the same cost for us to get a small margin of a profit?
The reimbursement, we want to optimize our reimbursement for the services that we provide.
It's really not a profit.
It's not a profit.
It covers the cost of the nurse and everybody.
Well, that's what the question was. So there's no profit then. Okay, that's all I want to know. Okay, thank you.
Ms. Marie?
Mr. Peterson?
Yes.
Mr. Gillespie?
Yes.
Mr. Britt?
Yes.
Mr. Cogbill?
Yes.
Dr. Ellis?
Yes.
Mr. McGill?
Yes.
Dr. Montgomery?
Yes.
Mr. Bullock?
Yes.
Mr. Hester?
Yes.
So the next item up is COVID-19, where we are today, where we're going with our vaccination and our testing. When we talked last week, we were concerned about the Labor Day weekend holiday. We're beginning to see that increase now. It started over the weekend. But today, our data look pretty good. Today, our positivity for Bladen County was 10%, and the state was 10.3%. Over the last 14 days, we have seen a leveling from around 16 to 17% to now 10 to 11 in Blaine County. So we're holding pretty close to what the North Carolina average is. We have 89 deaths. We have had some deaths since we talked last time. So we have had 48% of our deaths since July the 1st, which is 43 of the 89. We had 16 deaths since September the 1st for a total of 18% of our COVID-related deaths. We currently have 7 in the hospital, and a couple of them are really, really sick, and we ask that you continue to offer prayers for folks that are sick and ill in our county and, of course, our state and nation. Today, we had 5,160 positive cases with 245 active. Compared to the state of 1,346,316 positive cases, 15,776 deaths, and 1,202,974. They had not updated the recovered, that's the recovered rate. They had not updated the recovered as of the 2 o'clock printing of this. Currently hospitalized in the state with 94% of the hospitals reporting. Traditionally, there's around the 96 or 97%. But 3,323, it seems to have leveled off a little bit at the 3,500 rate. So again, I said last time that we really need to kind of hold our breath and get ready to see what is coming. But right now, we're holding our own in Bladen County. Right now, we have 47% of the population in Bladen County that has received a first-time dose, with 42% fully vaccinated. It's increasing somewhere around 0.5% to 1% every week to 10 days. We continue to offer our at-home vaccinations for those that are homebound. We continue to have the BARTS transportation and had someone come today on BARTS. We, of course, as you talked about earlier, we have been out in the community and would continue to do so. Of the cases that we have had the increase in the 0 to 17 population. Our total number of cases there now is 14.8% in that 0 to 17. And remember, we were running around Christmas and January in the 10 to 11%. The 25 to 49 continues to be our largest group, and that's the 37.2%, and the one that's not so much vaccinated right now. Our older population, the 65 to 74, has a 9.9% of our total cases, with 5.5% of them being 75 or older. So 65 and over total is 15.5% as compared to the 25 to 49, 37%. So the vaccine is working as shown in that larger age group. We continue to have more females than males at 54% for females and males at 45%. The cases by race, we have 21.9% African American, 47.4% Caucasian, and 12.1% Hispanic. So it's the Hispanic group that proportionally is in Bladen County the one that is that we really need to work on our outreach efforts. So they've tried really hard to. I spoke with the Catholic Church a week or two ago, and we're trying to work with them. So we continue testing at the health department, so Monday through Friday, from 8:30 to 4:30. We increased our time a little bit there, and they averaged anywhere between 125 to 200 and some testing per day. They haven't been able to do PCR, the rapid testing. I mentioned that last time I was here, that there's a national shortage, so we've been doing PCR testing primarily for the last 2 weeks. We continue to offer vaccinations Monday through Friday from 9 to 4 and have extended our hours as reported on last time to Tuesday until 7 o'clock.
Good.
Any questions?
How many people are you vaccinating on average per week?
It depends. We have on any given day. Like today, we did 58 today.
Vaccination.
Yes, sir.
I'll make two brief comments. The first, Jack, I keep hearing, and I don't want anybody to think this idea that if you get the shot, you're good. Two of those deaths that you mentioned in the last 30 days were our church members, both fully vaccinated. Very heartbreaking because they said, "What happened? I did everything right." So there's, we do need to continue to pray and offer support and all that kind of thing. People are dying, but also I want us to be very, very careful. We grew up in school, and the poor kids were made fun of by the rich kids or whatever. And there's beginning to be an ostracization in the schools, and kids, going up, "Hey, have you got your shot? Have you got," that sort of thing. And I know one of my children was in school, and a child came to school, fully vaccinated, kind of gave the other kids a hard time. "I got my shot, you need to get your shot," kind of thing. It's amazing, We used to make fun of people for their tennis shoes, now that's where they got your vaccine, but anyway. And, but the child that bragged the fact that he had his shots ended up having symptoms, testing positive for COVID. Well, subsequently, the teacher, the school nurse, had to check all the students that were in the class. And the students that were in the class who had received their vaccines were able to continue coming to school. The students who were not vaccinated were sent home because of a student in class fully vaccinated who tested positive. So now you got this class going, we know exactly who's vaccinated and who's not. And the fact of the matter is, as a child, the chance of dying from COVID is so minuscule. And I hate to see what's happening in our schools. I hate to see what's happening in our community. We say, well, we want to put something on a ballot so people can have choice. I don't know. I hear if the vaccine worked 100% and you couldn't get sick and you couldn't die and you couldn't spread it, but obviously the schools are saying, well, hey, we're afraid this vaccinated kid may have spread it to everybody in the class, so we better send all the unvaccinated kids home. That's just the most illogical, absurd thing. And what I feel like my child's sent home and go, we're going to put you in your place because you won't take your shot. And eventually, if we keep sending these kids home enough, the parents are going to go, I can't do this anymore. Get them their shot. Whether it's paying them to get a shot or whether it's manipulating them or ostracizing them, it's scary. It's just very, very scary. And again, we're a free country. That's my 2 cents worth, Chairman.
Mr. Chair,
Anyone else?
this is Dr. Montgomery.
Yes, ma'am.
I have three things, and I want to piggyback to one thing that Ms. McGill just said. I guess, Dr. Duncan, for me, some of the schools have different policies. I thought they had one policy says that if a child wore a mask and maybe a student was positive, will that child have to stay home? Well, anyway, there's an issue in a couple of schools. And I talked to the superintendent tonight about that because these same children, some of them are staying home. They have to isolate, I guess, because somebody was positive. And now they're not even getting homework. They can't do anything. What's the policy for the students? Because I'm dealing with one now that's personal.
So the schools are following in Bladen County the North Carolina School Toolkit, and the guidelines are there for isolation and quarantine. And there are several options, and depending upon whether or not an individual was vaccinated or whether or not an individual had COVID within the last 3 months. And then, of course, looking at whether or not they had their mask on. And the contact tracing is actually done in the school system by the nurse and the administrators.
So I guess if the nurse tells them to stay home, they need to stay home. Isolate, correct?
That's correct.
Okay. So I talked to Dr. Atkinson. I guess he'll get with you sometime this week. My second question is, if a person was hospitalized for COVID a month ago, if they were readmitted to the hospital for, let's say, some of those issues that affects of COVID later, are they considered in your same numbers in the hospital for COVID? They don't have COVID now.
it's my understanding there are many people that, or there are some people in the hospital that once their if they're COVID positive and their isolation period is over, but they remain in the hospital sometimes for weeks and a month, then they're not counted in the COVID positive cases for that day.
Okay, good. And I guess my last question is, when you gave your numbers tonight for those that were vaccinated, at least their first vaccination, those numbers that were done by over the weekend, are those numbers included?
If they were put into the CVS system, they probably would have rolled over today.
Okay, thank you.
Mr. Bull? Did you, in Dublin Saturday, did you have an event there for shots and testing?
We did not. We were there for educational purposes.
Okay. No shots and testing.
No, sir.
Question I know with funding, I've heard Mr. Martin talk about the funding levels. When you have your staff working, doing these events, how is that funding? Is that overtime, regular time, or how are you monthly funding these guys to handle those things?
They have day sheets, and they every day they put how many hours that they report if they worked in COVID or they worked in family planning, whatever department they worked. And remember that y'all have provided or approved the COVID nurses, part-time and full-time COVID nurses, and that funding has come from federal and state opportunities as well as some grants.
Okay, well, imagine, but overtime, has any of them accrued overtime? Do you have any conflict with them if it's an overtime situation?
No, sir.
We don't pay overtime?
We have not had to do overtime.
You don't do it?
I mean, we were seeing 300 people a day at the health department, and we are prepared when, you know that the FDA has recommended the booster shots now for those that are 65 years or older for Pfizer. But once the FDA makes their recommendation and the CDC and the ICEP has to meet and make the final guidelines, but we're preparing for the additional booster shots. At our height, we could give 300 vaccines safely a day with nobody waiting outside in line. We know that now we don't have quite the personnel that we had before because our EMS is really busy, the hospital staff is really busy. But we're making plans now. We'll be able to put those shots in the arms.
The first I'm asking, if I was to ask you to schedule, or someone in the public to schedule an event on Saturday or Sunday, would there be a conflict with you getting someone to cover that event? That's what I'm asking.
I would work as within the county policy to cover those events.
I just want to make a comment real quick, just one last thing, and I'm not trying to rebut what Pastor McGill brought up. I think in healthcare, a lot of times talking about COVID, I agree with your point about vaccinated, unvaccinated, but I see quite a bit just from being involved in healthcare to a certain extent that, like, state of Virginia comes out, they said at one point 98.4% of their ICU beds were unvaccinated individuals. That was the state of Virginia. Unless they're lying to us, that's a very high percent. UNC healthcare system, right here, public knowledge, you can go look at it, 87.7% in their ICU was unvaccinated, 12.3 vaccinated. I know Atrium Health and then Wake Baptist out of Winston-Salem, they were in the 94 percentiles, both of them, and you go look them up yourself. So I think a lot of times when we're trying to talk about, I don't think that it's people running around scared to death of COVID. I think people are trying to generally in healthcare, trying to, make decisions that it's very young still, trying to make decisions to do things which are right. Unfortunately, learning a little bit as you go, but it's just a whole different world with COVID. But I think those kind of numbers like that, I think that's why there's still concern to keep doing what we've been doing and trying to do the best that we can, so.
Dr. Duncan, the gentleman, I can't think of his name, to come last week to give y'all an attaboy. Thank you for what you're doing. And also needs to be extended to Nathan's crew and David Howe's crew and whoever else is on. Don't leave anybody out. The job that you are doing, and it's being done well, and there's a lot of people recognizing it. And
you've said you can handle it, that they'll just bring it to you. So, you know, you need to listen to what she's telling you people. We don't need everybody in the world coming up here giving shots. We can handle it in our health department. Thank you, ma'am.
Mr. Chair, that's a good comment. At the same time, I think Ms. Dr. Duncan recommended wearing a mask, but we don't want to do that. So I appreciate everything they do.
No, the commissioners did recommend that people wear masks.
Yeah, we highly recommend it.
That's exactly what we voted on. Advisory Board Appointment, Beaver Management Program Advisory Committee, there's 3 there. That's a new committee. Can I get a motion to reappoint? Motion. Right, second by Dr. Ellis. Any discussion? Ms. Marie?
Peterson,
Yes.
Mr. Gillespie,
Yes.
Mr. Britt,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yes.
Mr. McGill,
Yes.
Dr. Montgomery,
Yes.
Mr. Bullock,
Yes.
Mr. Hester,
Yes.
Second one is Blaine County Watershed Review Board.
Motion to reappoint.
Reappoint by Mr. Gillespie, second by Mr. Bullock. Any discussion? Ms. Marie? Yes.
Mr. Peterson, Mr. Gillespie,
Yes.
Mr. Britt,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yes.
Mr. McGill,
Yes.
Dr. Montgomery,
Yes.
Mr. Bullock,
Yes.
Mr. Hester,
Yes. To the Voluntary Agricultural District Committee, there's 2. Motion to reappoint. Second. Mr. Bullock made motion, second by Mr. Hester. Any discussion? Ms. Marie?
Mr. Peterson,
Yes.
Mr. Gillespie,
Yes.
Mr. Britt,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yes.
Mr. McGill,
Yes.
Dr. Montgomery,
Dr. O.T.
Yes. Yes. I apologize.
Okay.
Mr. Bullock,
Yes.
Mr. Hester,
Yes.
Okay, thank you. Item 10 is advisory board appointments for October the 18th, EMS White Lake Planning and Zoning Board. Item 11 is county management department.
Thank you, Mr. Chairman. I'd like to first begin by reviewing the calendar for the remainder of September and October. Point out that tomorrow evening at 6:30 p.m., the Bladen County Substance Use Disorder Task Force meeting in the Blaine Community College Auditorium. Also tomorrow evening at 7 p.m., there's a special joint meeting with the Board of Commissioners and the Planning Board at 7 p.m. That's again at 7 p.m. at the Ag Center.
Mark, is there an agenda for this meeting or what's going to take place? Have we seen anything or?
I saw a PowerPoint today.
Okay.
And we'll send that out to you.
Okay.
Primarily, it's to discuss the rezoning process, among other things, that in particular.
Yeah. Okay, thanks, sir.
Moving over to October, on Friday the 1st, from 7 until 10, the Sunset Jams concert series featuring North Tower take place here in town. On Monday the 4th at 8 a.m., there's a prayer service here. Also, the board meets that evening at 6:30 p.m. Thursday the 7th at 12 noon, the Juvenile Crime Prevention Council meeting will be held at Ag Center. Saturday the 9th, 9 until 3 p.m. Great Festival at Louisville Vineyard will take place, and that continues the Sunday. Also on Sunday at the 10th, the Clash of the Carolinas Triathlon will take place every week. Ag 'em Up Day will be held Monday the 11th through Wednesday the 13th for third grade students. On Monday the 11th at 5 p.m., the Health and Human Services Advisory Committee meets. Sunday the 17th, there's a great skate bike tour, Cape Fear Winery here in Elizabethtown. Monday the 18th at 6:30, the board meets. So on the 19th at 6, substance use.
As far as, I don't know if the new commissioners had opportunity to do an Ag 'em Up Day, but that's at the county park. But they invite commissioners to stop by and visit. You have the opportunity that day, one of the days. I'm sorry.
Mr. Chairman, the format, if I'm not mistaken, the format may be a little different this year.
Oh, is it?
I don't think it's going to be at the county park, but we'll clarify that.
Okay.
Thank you.
Okay, I'm sorry.
Moving on to item B, if these retirees are not able to be here this evening, but we do want to formally recognize Mr. Wallace Stevens, who recently retired from the county. He worked in building maintenance. And also Mrs. Martha Walker, she retired as a nutrition site manager with the Division on Aging, and she served for 13 years. So congratulate both of them and wish them the very best.
Mr. Mark, do we have to, go back and hire additional, due to these retirements? Additional folks
Yes, sir. We have those positions,
available?
yes, well, if not already filled.
Okay.
Because they both retired in August, so it's
Okay.
And because they were retiring, because we knew they were retiring, we had. Moving to item C, the board is requested to consider approving a proposal from the Lumber River Council of Governments related to the redistricting process. If the population and demographics have varied by a certain percentage, certain threshold is met with the changes, then the county commissioner districts will need to be redrawn. So the Council of Governments has helped us in past years with this. They purchased the software from Esri, and that way each of the counties in the district, in the regions is not required.
Yeah, second. Motion by Mr. Britt, second by Mr. Cameron. Any discussion? So that might be some special meetings as soon as we find out what we're doing.
Yeah, will, yes, sir.
Okay. Great.
Peters,
Yes.
Mr. Gillespie,
Yes.
Mr. Britt,
Yes.
Mr. Cogdell,
Yes.
Dr. Ellis,
Yes.
Mr. McGill,
Yes.
Dr. Mongolen,
Yes.
Mr. Bullock,
Yes.
Mr. Hester.
Yes.
All right, moving to item D. We have two very straightforward provisions proposed to the personnel policy. The first is just to specify the number of days for that are carried over for annual leave. In the past, it's stated 230 days or 225 hours. For those employees who work 80 hours or 84 hours or 85 hours per week, it needs to be 240, 252, and 255. So it's more specific.
Well, you don't, I'll ask you a question.
Yes, sir.
Are we still using camp services to hire people?
It just depends. I mean, occasionally.
Why are we using them when we try, it's so hard to find people? Why are we using camp services?
Well, because it's sometimes in certain cases it's a good way, a useful way to quickly obtain.
But my question is, how long do they convert over to being full-time employees? Do we have a limit on it? A month, 2 months?
I don't know. I mean, I'm not familiar with anyone.
A lot of temporary services is just temporary work that's trained in these jobs, and they come right in and go to work till they usually advertise.
So the only reason I was asking, I know some of the guys at the landfill have been out there working for the last 2 months, or longer, 3 months.
That's because we're having a challenge hiring.
They're working out there, but they've been out there for 3 months, and someone telling me they get relief at 1 hour full-time.
And I just thought of another
They
point.
say they get relief.
Okay, one of the issues at solid waste is that we've had folks out health-related leave. And so we don't have vacant positions to fill. We have these temporary employees working until hopefully these full-time employees are able to get back.
But now some of them ain't satisfied with the situation. They talking about leave, so you may have to get some more temporary.
I'll talk.
Okay. Mr. Bullock.
You mentioned something about 230 days. They can carry that over into the next year.
Hours.
230. Oh wow! I didn't say 230 days.
225 hours, 240, 252.
Okay. I thought when you said day, I thought you said days. I said, Lord.
Any other comments?
Okay.
Well, and one other one, Mr. Chairman, and that is to specify, this is in section 7 under separation, to specify that employees who separated are not reinstated with the county. You need to add the provision in a full-time position within a period of 2 years shall lose all sick leave. So in a full-time position needs to be.
Mr. Chairman, so Mr. Martin, in this 230 hours, if I got 500, well, 240, and I don't use them, I just lose the 10 hours. If I don't use them by a certain point.
It rolls sick leave.
Okay.
Where?
Okay.
The maximum amount that the county will pay out at any given time as well.
Okay. Motion we approve. Mr. Gill, second by Mr. Britt. Any more discussion? Ms. Marie?
Mr. Peterson,
Yes.
Gillespie,
Yes.
Mr. Brett,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yes.
Mr. McGill,
Yes.
Dr. Mungoin,
Yes.
Mr. Bullock,
Yes.
Mr. Hester.
Yes. Thank you. Moving to item D. We have a draft copy of the digital inclusion plan for your review. Hopefully, and also include your consideration at the next meeting. But I just want to let you know we had a committee of representatives from various agencies participating on this committee. Been recommended to you. I just want to point out the main purposes and main goals. The first is to improve broadband connectivity and access throughout the county. The second is to improve digital literacy skills. The third is to integrate digital inclusion strategies into community economic development efforts. So hopefully this is the beginning of a long-term effort in this regard, but we want to be in a position to be able to hopefully obtain grant funding and that type of thing. And this is an important step in that process.
And doing the, survey too is important.
Yes, sir. That's one thing I'm glad you just mentioned that. This plan references a survey. You all know that the Lumber River Council of Governments has just completed the survey 17 deadline. So that data is what will be incorporated in this. So that's still draft at this point. I want you to know that, but that is.
They extended it, didn't they?
Yeah. To the
17th was last.
Yeah, that was.
That was extension?
Yes.
Yep, yeah.
Well, forget it.
But now, they were looking for what percentage in order to meet a certain goal?
Real low.
Yeah, it was a low percentage, but we were still on.
We did,
last time they reported, we were on.
Yeah. Okay.
I'll, read the material Mr. Mark passed out.
And then, moving to item F. You all have heard of, red leg grants, revolving loan grants. Fort County DMC loans money to local governments and volunteer fire departments and that type of thing for capital purchases. Fort County obtains a grant from USDA Rural Development to loan, so they have the funds to loan. When those funds are reimbursed or paid back to Fort County, they can then loan those funds to economic development projects like Bladen County, agri-industrial, and those types of projects at 0% for up to 10 years. And so we have proposed to borrow at 0% interest for 5 years, funding for a new garbage truck and ambulance, as well as for the 10 patrol cars for sheriff's office this year. So basically what we'll be able to do, if this is approved to move forward, and Fort County's board approves it, then we'll be able to do a budget amendment, reimburse at basically 80% of the funds back to the general fund this year. And then
I'm still approved.
Motion to approve the FNG. Motion by Mr. Brett to approve the FNG.
Second.
Second, Mr. Bullock. Any discussion? Ms. Marie?
Mr. Peterson.
Yes.
Mr. Gillespie,
Yes.
Mr. Brett,
Yes.
Mr. Cogdale,
Yes.
Dr. Ellis,
Yes.
Mr. McGee.
Yes.
Dr. Mungoin,
Yes.
Mr. Bullock.
Yes.
Mr. Hester.
Yes. Individual delegation wish to address the commission.
Anthony Thomas.
Thomas?
All right, good evening again. I do want to provide clarity. Dr. Ellis asked a couple of questions, and I was prepared to come to the floor to answer, but I was stopped.
No, we don't take questions and answers on the floor, sir. That's why it's out of line asking you to do that.
Okay. So I thought
that's the reason I give you an opportunity to speak now.
All right, so let's get, just to answer your questions and leading into the work that we've done. I'm not speaking on behalf of any entity. I'm speaking as a resident of Bladen County. I have a vested interest in seeing that our county is safe. I've contacted Dr. Duncan multiple months ago, and we've conversed via email and telephone. In fact, there was a vaccination clinic many months ago, sometime last year, in Harper's Creek, the Baltimore Center, something that they were sponsoring. We were there providing support services, providing food, financial assistance, whatever folks needed at the time. So we worked with the health department. There was also a vaccination clinic in Bladen, which was reported before. It had very low numbers. We actually assisted. We had Ms. Janae Ventura to be out in the community. We went over knocking on doors in the subsidized income facilities, elderly apartments, making people aware that the health department is in Bladenboro at the fire department at this time. There was someone who was unable to leave their residence. We were able to coordinate. Is it Allison, the health department, the nurse? Okay.
Allison coordinate.
Right, so she was able to coordinate that. That's because we went knocking on doors. What we did, we don't work solely in Bladen County. We work in 9 different counties. So there's Robinson County, Bladen, Columbus, and so on. We see what other health departments are doing and how they're addressing COVID. It's unique in every county. What I did was I did have a conversation with Dr. Duncan regarding the $100 gift cards as we've seen vaccination clinics, soar in numbers. We've reported before we've had smaller numbers, somewhere 5 or 6 at different times, and that's a little bit frustrating because you have people that are advocating and telling folks the importance of being vaccinated, and they just don't show up for the clinic. So as the other counties implemented at no cost to the county commissioners, nothing but the county budget, as they implemented this resource, then they saw those numbers increase. And so because we were allowed cards here in Bladen County, and then the group or the county commission collectively agreed not to move forward in that direction, we thought we found another vendor who was also approved by the state to come in and to provide vaccinations. Now, there were all types of people there. As Mr. Cogdell said, it was a well-diverse group of individuals who were there, a larger group than what we anticipated to be present, which is a good thing. When you see vaccination clinics, it costs you the same amount of money to set it up, and you have 5 people to show up if you have 25 people to show up. You want to maximize those efforts. And so that's what Saturday was about. It wasn't about making a statement. It was about helping the communities. Now, what happens is that $100, it sounds like, that's not a lot of money, but it all depends on the possessor. If you have $100,000 and someone gives you $100, it doesn't have the same value as if you have a negative bank account balance and someone gives you $100. So that was the actual purpose of this. Yeah.
Go ahead, finish.
So that was the actual purpose of Saturday. What we did was we had a resource in the county as, in our hand. And it could have prevented, as Dr. Duncan reported, the number of deaths and hospitalizations. We possibly could have decreased those numbers had we encouraged folks to be vaccinated, even with this incentive at no cost to us. So to say you are exactly right, Dr. Ellis, in my presentation at the last county commissioner meeting, I did not ask Dr. Duncan to do any vaccinations, and that was not a part of the plan. So you are 100% correct. And I know that you were addressing me at the back. I'm not sure if you were focusing on me because I was in front of you, but I did not make that call. Now, what I will say is that I did invite Dr. Duncan, and I also invited her staff in the meeting, and you were going to bring some materials, and she was present there for a while. So I wasn't kind of clueless on what you were saying. I just needed clarity on that. As I came forward to address it, to say, just explain that to me, just so that I was clear. I was abruptly started, and if I may say to Chairman Peterson, it kind of caught me off guard. I understand the process and the protocol.
Mr. Thomas, but don't let people from the audience address the commissioners. No. I guess there's 2 places for you to address the commissioners, and you're out of line as a commissioner if you ask someone the audience a question. I'm sorry, that's just the way we operate.
That's what I was getting to. You just said it. You said, I'm sorry.
That's the way we operate.
Right, as I was coming up, it's not what you say, it's how you say it. I didn't know that process.
You didn't get the message the first time. I had to keep telling you, kept coming.
Oh, I think you said it one time.
Move on, Mr. Thomas.
All righty. So, but it's not what you say, it's how you say it. So, doesn't cost a thing to be nice. So does that answer your question, Dr. Ellis?
It does, and I want to make a statement too. Number one thing, being out of line, I was really making more of a statement at the time. My whole position was the fact that I understood it not to be a collaborative effort. The presentation we had to the commissioners being suggested was that Dr. Duncan was not there. I was trying to get across the point that she had not been invited to be there as though as a joint venture.
Okay.
That was my only thing. I didn't mean to pose it as a question, so in other words, I can see how you got confused. And if I was out of line, then, really meant it more of a statement was my declaration.
Right.
You know, so I think anytime we're looking at the health department saying, well, you didn't do this, you didn't do that, I was going back to my memory that when you presented that given night, you never said, I would like the full participation of the county in this event. You came up and said, we're doing this event, which kind of circumvented what we had passed to the board not to do the $100 gift card. You know, we listened to the presentation and you moved forward, but then to turn around tonight and act like Dr. Duncan, where was she Saturday? We couldn't give her to get shots. We can't, you know, it just kind of caught me off guard, so I was trying to get clarity.
So, okay, so are you saying that I did that? Is what I'm just trying to.
No, I'm saying when it was brought up that we need more collaboration, I was trying to point out the fact that there really wasn't collaboration to have our department there.
Right.
It was in the 11th hour that, oh my God, look at all these people. We need reinforcement. And I think in that given position, it's difficult anytime. Even when you call on excess fire departments, it can be difficult.
And I think we can all agree with this. It was a good problem to have a large.
It was, yeah, without a doubt.
And so that'll prepare us for the next event or future events that we may have.
Right.
That we could partner closer with the health department to say, this is what we can do.
Let me interrupt you. I thought I made myself clear. Unless this board changes their decision, we're not gonna support paying people to take a shot.
Well, that's not necessarily what we always do is support.
Well, I mean, if you're paying people like, we're not gonna participate as a county unless this board changes their decision.
Like, I want to be very clear. We don't pay individuals to take shots.
This was a money to get the shot. This county's not gonna support it unless this board revotes. We voted not to support it, so we're not gonna let you undermine what this board of commissioners has voted on in this county. So if you're planning on giving them money, you need to bring back this board for a vote or something. I'm giving you a heads up.
If I may say this in closing, just to respond to what you said, there are other vaccination clinics that we have done that is actually there is no incentive, there's no gift card that's issued to anyone. And so whenever I say future events, it could be at the discretion of Dr. Duncan to say, we're going to do this there. We've gone out knocking on doors. It was their event. We passed some information to actually promote the event. That's a partnership. So your question, you may not like my answer, but that was the answer to your question.
Well, you understand where I stand, where this board stands, right?
I'm very clear on that.
Thank you. Thank you, Mr. Thomas.
You're quite welcome. My pleasure.
So, let me make sure I'm understanding. We are not saying that he's not in, his organization is not invited.
I'm saying, Mr. Cogdell,
we just as a county, we will not participate.
We voted not to give the $100, the money incentives as a board. He can come to Blaine County, do whatever he likes to do, but we're not, as a county, unless we take another vote, I don't think that we should support something that we voted against.
So we really understand it. If he comes back in, I want to make sure I'm understanding what we're doing. If he comes back and decides to do the second thing, and if he brings in his gift cards, the only thing we would do, we would not involve Ms. Duncan. Is that what you're saying?
We as a county, I don't think should support it because we voted against it.
So we're not going to involve her.
That's the way I take it.
Fine with me. Just make sure we got to understand.
Okay.
Dr. Molly Glenn.
I'm Dr. Molly Glenn. I'm chairman of the Health and Human Services Advisory Committee, and I have been in attendance for these meetings for the last several weeks in support of Dr. Duncan. And I just want to make a comment. You guys are the Board of Health. Remind each and every one of you that you guys assumed that responsibility several years ago when you chose to consolidate. And our committee serves as an advisory committee. And the Saturday event, I got a call from Dr. Duncan because she was called in the 11th hour, just as you mentioned, because of a crisis that all of a sudden became her emergency. And it was the organization who organized the meeting on Saturday and gathered all these people. And because of a car breakdown, is what we were told, I'm assuming, that the staff didn't show, that they didn't have the people there to be able to administer the vaccine. And to call Dr. Duncan at 1 o'clock and say, hey, can you get staff out here, is a little bit, it's unacceptable to criticize public health in Bladen County because of that event. And I am here to represent her, our committee, her staff, the hospital, everyone who has done everything, waking hours, 7 days a week,
She has put forth the effort. She has gone to all parts of this county and administered 0 vaccines. She's administered 300 vaccines in a day at her clinic. So to condemn her for not showing at 1 o'clock on a Saturday, and Mr. Dallas as well, as far as his staff, to include them in that, is despicable. And I think that we need to step back and think about everything that's been done and something that was a crisis that all of a sudden was made an emergency for her.
Peter, can I say one thing this to the doctor there? And I'm looking at what we are saying. I'm trying to make sure I'm understanding what's been said. I did not say that Ms. Duncan did anything wrong. I did not say she was insufficient to do her job. I never said that about her at all. I said it was a communication breakdown that I hope that we can correct if it ever was to occur again. I did not accuse her. I didn't beat her down. Me and Ms. Ellis talked about it, and I said I would not do that to her because it was the last hour when I called her. And when she told me what she had to do, I said, fine. I called around, that was the issue. We done jumped up on this thing like somebody done drove Miss Duncan across the coast.
Well, from what
That's the perception that you got, but that was not the comment I made. I said it was a big lack of communication. I didn't know what the situation was. I had no idea. I was just trying to get some help, and she told me why she could not help me.
And I think
And at that point in time, everything proceeded on as normal. Who got shot for that? My only thing was saying I hope that we could work in conjunction the next time that this event happened. That was what I said. I just said a thing about Ms. Duncan not being sufficient with her job. Not one time.
Well, I heard about this.
I didn't say that.
Mr. Cogdell, that's the reason the television stays here, not because you called her and you threatened our employees that you were gonna call WCT and everything.
I ain't threatening nobody. She asked me what was going on down here in Bladen County, and I told her what was going on in Bladen County. That we had people leaving because we could not get vaccines and the people armed. Y'all sitting here, you're making your own stories about what you didn't hear.
Okay, Dr. Mann, please finish.
I want to commend Mount Calvary and their efforts also, because, I mean, they're serving several counties and they are doing, it's not just about a vaccine card, it's about providing services for people who have been affected by COVID and the resources that they do when they've not been able to leave their homes. So they are doing a great job. I do completely agree with you on the communication background.
It's communication breakdown.
And I think that from that standpoint, there's been miscommunication across the board. And so, and from the beginning. And I think that when an outside organization comes in and tries to do something that she's been doing all along and is not involved in the process, it certainly can present a situation where perception becomes a major issue.
That's all it is.
Thank you. I entertain a motion. Anybody else? Any matters of interest to commissioners? Want to say anything? Entertain a motion to go into closed section for performance MCG 143-318.11, real estate purchase price negotiation. Motion by Mr. Brett, second by Mr. Cameron. Any discussion? Ms. Marie.
Mr. Peterson.
Yes.
Mr. Gillespie. Yes. Mr. Brett.
Yes.
Mr. Cogdell.
Yes.
Dr. Ellis.
Yes.
Mr. McGill.
Yes.
Dr. Mungoen.
Yes.
Mr. Bullock.
Yes.
Mr. Hester.
Yes.
This conference will now be recorded.
All right, entertain a motion to adjourn.
Motion to adjourn.
Second. Any discussion? All, Ms. Marie.
Mr. Peterson.
Yes.
Mr. Gillespie.
Yes.
Mr. Brett.
Yes.
Mr. Cogdell.
Yes.
Dr. Ellis.
Yes.
Mr. McGill.
Yes.
Dr. Mungoen.
Yes.
Mr. Bullock.
Yes.
Mr. Hester.
Yes.
Thank you, guys. Good night.
Good night, everybody.
See y'all tomorrow night. Y'all want to keep you awake all the way up there.
3 hours, thank you.